Our hospitals statewide are approaching maximal capacity, not because of limitations of safety supplies or physical beds, but because we're exhausting the available supply of trained personnel.
Medical experts across the state of Ohio say the pandemic is putting their staff members in the line of fire right now. This as the number of COVID-19 cases and even hospitalizations sees an unprecedented spike.
WCPO 9 News reporter Kristen Swilley shares the impact those in the medical field say the virus is making on the people helping the sick.
The scarcity issue we could face is twofold: a lack of physical space and a potential personnel shortage as nurses have to quarantine.
It is different. It's very different.
Shiva Krute has helped heal the sick for 3 decades. She now teaches, but says no lessons can fully prepare her students for COVID-19.
Besides being sick, you might get sick. Your family member, you don't want to bring nothing home to them.
Medical professionals from across Ohio addressed the state, sharing data and pleading with the public to socially distance. Among them, the president and CEO of UC Health.
We are seeing an exponential growth, a growth in hospital cases that's doubling every 21 days.
And he says that if the numbers don't slow soon, it will start to affect space and staff like never before.
It is at that point that you start to exhaust the resources that my colleagues have mentioned, and most notably staff in terms of that. And it would result in us needing to think about deferring non-COVID care.
The hospital leaders say many nurses are now having to quarantine because they've contracted the virus or lived with someone who has. Combine that with the potential lack of bed space, and the experts worry things will get worse.
Someone's calling off and she's mandatory to stay 16 hours. That's a problem.
The medical professionals say that as these COVID cases rise, it's a reminder we haven't even hit peak flu season yet, meaning that if certain things don't change, like increased social distancing, we could be in for a very long winter. Kristen Swilley, WCPO 9 News.